Welcome to this video guide on understanding your thyroid test results. This resource is designed to help patients and their families better understand their lab reports and facilitate more productive conversations with their doctors. Please note that this guide is not a replacement for medical advice. Your physician is the only one who can properly interpret your results. It's important to understand what this guide can and cannot do. It can help you understand test measurements, navigate your lab report, and prepare questions for your doctor. However, it cannot provide a diagnosis, determine your medication dosage, or replace your doctor's clinical judgment. Remember, your overall health picture involves more than just numbers. To make the most of this guide, review it before your appointment to familiarize yourself with the terminology. Bring a copy or photo of your actual lab report with you. Write down any specific questions you have, and remember to let your doctor interpret the findings, as they have the full context of your medical history. Part 1 of this video covers the basics of your thyroid, explaining what it is and the vital role it plays in your body's daily function. The thyroid is a small, butterfly-shaped gland located in the front of your neck. Though small, its job is massive. It produces hormones that set the pace for your entire body. Almost every organ in your system responds to these hormones, making the thyroid the gland that effectively sets your body's speed. Because thyroid hormones influence how fast your body operates, levels that are too high or low can affect your heart rate, body temperature, weight, sleep, mood, and digestion. Note, however, that these symptoms are common to many conditions, so experiencing them doesn't automatically mean you have a thyroid problem. Your body controls thyroid hormone levels using a system much like a home thermostat. Your pituitary gland acts as the sensor, and the thyroid gland acts as the heater. If the pituitary senses low hormone levels, it releases TSH, a signal telling the thyroid to work harder. Understanding this relationship is essential to interpreting your result. The most confusing part for many people is that TSH levels move in the opposite direction of thyroid hormone levels. If your thyroid is underactive, the pituitary shouts by raising TSH levels. Conversely, if your thyroid is overactive, the pituitary backs off and TSH levels drop. In the next part of this video, we will break down the specific tests you might find on your lab report and what those measurements actually mean for you. You may see several tests on your report. TSH is the primary screening signal from your brain. Free T4 is the main hormone in its available form, while free T3 is a more active form that isn't always tested. Finally, antibody tests may be ordered to see if your immune system is involved in your thyroid function. TSH is usually the first test checked because it is highly sensitive to changes. A high TSH result typically suggests an underactive thyroid, while a low result can suggest an overactive one. Keep in mind that a single out-of-range result doesn't automatically mean you need treatment. Your doctor may want to retest. Free T4 represents the main hormone your thyroid produces. The word free indicates that this is the portion currently floating in your blood, ready for your body to use. Your doctor uses this in conjunction with TSH to get a clearer picture of your thyroid function. Free T3 is a more active form of the thyroid hormone that your body creates by converting T4. Antibody tests are also sometimes used to determine if the immune system is affecting your thyroid gland. These tests help explain the cause of thyroid issues, though they are usually performed only once. In this final section, we will cover how to read your lab report, ensuring you can make sense of the various numbers, units, and ranges presented to you. When reading your lab report, always compare your result against the reference range printed on your own specific report, as these can vary between laboratories. Additionally, be aware that tests may be reported in different units. Ensure you are looking at the correct range for the units listed. It's important to understand that normal ranges vary between laboratories. Each lab establishes its own range based on its equipment and the population it tests. Because of this, a result flagged as high at one lab might be considered in range at another. Always use the reference range provided on your specific report to interpret your results. Your doctor interprets your results by looking at the trend over time rather than just a single snapshot. Thyroid hormone levels can fluctuate naturally, so tracking several results helps determine if your condition is stable, improving, or drifting. Keeping your past results in one place is a helpful habit for these discussions. Now let's explore what common patterns in your test results might mean. Please keep in mind that these are general interpretations and only represent a starting point for your doctor to consider alongside your overall health. When reviewing patterns, it is important to remember that these are not rules. Factors like illness, pregnancy, certain medications, and rare health conditions can change what a specific pattern means for you. Always consult your healthcare provider for an interpretation tailored to your situation. An underactive thyroid or hypothyroidism often leads to symptoms like persistent tiredness, weight gain, feeling cold, and dry skin. If confirmed by repeat testing, treatment typically involves replacing the missing hormone. Once your correct dosage is found and you are stable, your need for frequent testing will decrease. An overactive thyroid or hyperthyroidism causes the body to run faster than usual. You might notice symptoms like a racing heartbeat, unintended weight loss, restlessness, or trouble sleeping. Your doctor will likely order additional tests to find the cause and discuss treatment options to manage your thyroid levels. Sometimes, only your TSH is out of range while free T4 remains normal. This is often called subclinical, meaning it is a mild finding that may not cause clear symptoms. Because a single result can be influenced by recent illness, your doctor may prefer to monitor the situation with repeat testing rather than treating immediately. Next, we will look at everyday factors that can influence your test results, which is a crucial consideration before your next blood draw. Be aware that biotin supplements can interfere with lab methods, potentially causing TSH to appear falsely low and T4 or T3 to appear falsely high. The American Thyroid Association recommends stopping biotin at least 2 days before testing. Always discuss your supplement list with your doctor. Timing is also a factor. If your dosage is changed, it takes about 6 to 8 weeks for your results to stabilize, so testing earlier may be misleading. Additionally, TSH levels fluctuate throughout the day, so try to have your blood drawn at a consistent time during each visit. Other factors, such as pregnancy, certain medications like steroids or lithium, and the timing of other supplements like iron or antacids can also impact your thyroid results. It is essential to provide your doctor with a complete list of all medications and supplements you take. In this final section, we'll discuss how to work effectively with your doctor to manage your thyroid health, including key questions to ask. When speaking with your doctor, don't hesitate to ask specific questions. Ask what your results mean for your health, whether a result is new, and when you should be retested. It's also helpful to ask which symptoms should prompt you to contact the office sooner than your next scheduled appointment. Never change your thyroid medication dose on your own. Thyroid medicine works slowly, and how you feel today may not reflect your underlying hormone levels. Changing your dose without medical guidance can lead to heart rhythm issues or other complications. Always discuss any concerns about your dosage with your physician. While thyroid issues are often managed through routine care, seek medical help promptly if you experience severe symptoms like chest pain, fainting, a pounding heart, or high fever with confusion. Do not wait for a scheduled blood test if you feel suddenly, severely unwell. Thank you for watching. To help you prepare for your next medical appointment, you can use a notebook to track your thyroid results and any questions you want to ask. Having this information organized makes it much easier to discuss your health with your doctor during your visit. In summary, remember these key points. TSH and thyroid hormones typically move in opposite directions. Always use the reference ranges from your own lab report. View your results as a trend over time. Disclose all supplements like biotin. Allow enough time for levels to stabilize after a change, and never adjust your medication dose yourself.